This is Kathryn Mensah. I'm a physician specialist in Ghana. I have an interest in geriatric neurology, and it's fun. I'm glad I'm here. It's fun to be here. And yeah, I am an IHS attendee. This is my first attendance, and I came here through a grant. So I'm grateful to the IHS for giving us the grants to be able to attend.
Francis, was it easy to get the IHS Junior grant?
Personally, I would say yes. It wasn't a lot of bureaucracy to get to the grant. All we had to do was apply, and then in I think short words, like 300 words, states why you needed a grant to attend. And I personally wrote about my experience as a patient suffering migraines and a physician treating people who have migraines. So that was what I personally wrote about. I was contacted, I think a few days or weeks after the application, and then I was told I'd been given the grant to attend.
Now we are in the IHC 2025 in Sao Paulo, Brazil. Can you share with us some insights from the conference?
Okay, so one thing I've learned now is that the GPANs are a source or an option to go if the triptans are not working. Unfortunately, in my country, even the triptans are hard to get because of the cost. So I don't know how soon we can get the GPANs in Ghana or that side of Africa, but that's something I'm taking back home. And hopefully we can look into how to, as a nation, how to get that class of medication into the country.
Francis, the presidential symposium in IHC 2025 was about the access to headache care in low middle income countries. How can you describe the situation in Ghana in treatment of migraine and treatment of headache in general?
Right. So in Ghana, unfortunately, we don't have a lot of neurologists and we don't have a lot of headache specialists. In my facility, there's only one headache specialist. Granted, every other physician or special neurologist can treat headaches, but there's only one person that is centered on headache care. And that's even in the biggest hospital in the whole country. So if we are to stretch to the other smaller facilities, it becomes harder to get somebody who is keen about the care of headache patients. So that's the challenge we have. A lot of patients are not able to identify their symptoms, and sometimes time to present to the hospital is a problem. So their symptoms may have started 3 months ago, but they are now presented. Or they may have been to pharmacies. In my area where I live, it's quite easy to get medications over the counter without any prescriptions. So they would have tried a plethora of medications before seeing any specialist. And that becomes a challenge because by the time they come, they may be having drug misuse headache. So then it's hard to sort of make the diagnosis at that point. And even when we do, for some headaches, most of the time you try to explain to patients that it's a clinical diagnosis, for example, for migraine. But patients feel like you need to do run tests, CT scans, and these things are quite expensive in my region. And yet, to be honest, it's not necessary in the diagnosis of migraine specifically. So those are some of the challenges we have. We don't have a lot of specialists. The patient's education is poor, and usually they resort to other treatment options rather than coming to the hospital. Yeah.
Thank you, Princess, for your time.